Welcome to About Seniors Talk TV. My name is Victor Oliveira and I'm your host. We have 10 shows being planned for production over the next few weeks. The objective of these shows are to be a continuous source of information for clients and families in the region of Peel. A little bit about me. I have worked in the healthcare sector for over 30 years and currently operate my own business facilitating care for older adults at home, or wherever home may be throughout the region of Peel. I started my career in the acute care sector and transitioned to geriatric care in 1989. My change to geriatric care was not an easy one for someone in their mid-20s. I disliked everything about it, the sights, the sounds, and the overall physical layout. Perhaps it was an acceptance of an inevitable aging process that scared me the most. Within the first year, I had fallen in love with the opportunity to truly make a difference in the lives of the clients who came into the facility. Once I accepted the difference between acute care and geriatric care, I was happy, and I knew that I could find fulfillment in my role. Acute care treats patients and works on a discharge plan. Geriatric care focuses on enriching and enhancing the quality of life in the later stages, and discharges are less common than the acute care sector. Through my different roles and promotions within the organization, I gained greater scope and control in having a direct impact in meeting clients' goals and objectives, focusing on providing services that were directly aligned with enhancing the lives of those we served. As an executive director for the organization, I knew that my decisions directly affected clients' quality and standard of care. Safety, well-being, and my passion for their personal care compelled me to make client-centered decisions. That meant decisions being made with client input, support, and collaboration. Unfortunately, I still felt that I was helping making people as comfortable as possible in an environment that was perhaps not their first choice. Many still wished it could have remained in their homes for as long as possible, instead of going into an institutional setting. After 26 years, I decided that my passion would be better served in the home care, facilitating care, promoting independence, and supporting the needs of families in caring for their loved ones. Essentially, I started to fulfill wishes in keeping older adults in their homes for as long as possible. However, navigating the process for home care is not easy. There are many factors to consider and information to sort through. As the host of About Seniors Talk TV, it's my goal to bring about transparency to some of the processes, openly engage guests, discuss topics relevant to care, wellness, safety, financial matters, and creating a suitable environment whereby older seniors can sustain their independence, obtain appropriate support while giving families peace of mind. So if you're a senior, know a senior, care for a senior, or simply plan to become a senior, this show is for you. We're now going to take a short break, and when we come back, we'll be joined by Natoya Hylton, a registered nurse with the Mississauga Halton Community Care Access Center. Stay with us. Welcome back to About Seniors Talk TV. Our first guest is Natoya Hylton, a registered nurse and care coordinator with the Mississauga Halton Community Care Access Center. She's been working there for about 12 years. Natoya holds a Bachelor of Science in Nursing from York University. She's completed a business management program at Humber College, a case management program through the Georgian College, and a Master of Divinity in Education at Tyndale University. Natoya is as passionate as they come when it comes to helping vulnerable clients in our community, giving hope, restoring independence, and provide or connect patients to necessary community supports, which ultimately improves their overall quality of life. Welcome to the show, Natoya.
Thank you for having me, Victor.
So how do people access the Mississauga Halton CCAC?
It is a very simple process. In order to access service at Mississauga Halton CCAC, one just has to dial 310 CCAC, no area code required. So that number is 310-2222.
Oh, that's easy enough.
Yes, it is. And the good thing about that is that Absolutely anyone can access service through CCAC. There is no need for a doctor's referral, so a patient, a family member, a neighbor, even a friend can call in order to access service.
Should certain triggers already be in place when a family or a client contacts CCAC?
In terms of triggers, you mean, can you elaborate on that?
You know, are families noticing any changes in their loved one, or they themselves are noticing that, you know, perhaps they're not as engaged as they previously were?
Yes. The patients who normally call in, or family members who call in, they realize that they can no longer manage safely in their home, that they need a bit of extra support. So normally there are some signs there. A patient might not be able to get in or out of the washroom, or might not be able to dress properly, or there might be something requiring a nursing service in terms of care for wound care, or it might be just that they need that extra support in order to stay in their home as long as possible. So yes, there are normally some triggers in place, and there's a need, which is the reason why they would call CCAC for support.
Oh, thank you. So when you get in touch with the Mississauga Halton CCAC, what happens next?
Normally, when a patient or their loved ones call CCAC, a care coordinator and or a team assistant would answer the phone, and a preliminary assessment would be conducted over the phone by that care coordinator, and they will assess to see what their needs are, their clinical needs, their social needs, and basically set up a temporary care plan, putting the necessary services in place, and then transferring the file to someone like myself, a community care coordinator, to go out and further assess what the needs are and connect that person with the care that they need.
Very good. So what happens at the first home visit with a care coordinator?
So at a first home visit, a care coordinator like myself, a community care coordinator, would go into the home and we'd assess to see what the situation is in home. It's one thing when you're speaking to someone over the phone as opposed to when you walk into the home and actually see the situation, experience what's going on. So a comprehensive assessment is conducted at that point in time, just to see, you know, how are they managing with the supports in home, how they're doing in terms of their clinical health or medical needs. And at that point in time, once we identify what the needs are, then together with the patient, we work on common goals and set up a care plan that actually meet those needs and those goals that are set by the patient and the care coordinator.
So the client and the family members are engaged in that process?
Definitely. They are the key players, and it's the client that actually sets the goal because they know what their needs are. They know what is most important to them. As a clinician or a health professional, I might go in and say, okay, all you need is for your wound to heal. And the patient might say, no, what is most important to me is that I actually am able to access the upper level of my home. I want to be able to sleep with my spouse. I want to be able to take a shower like a normal person and not necessarily do so at the sink because I can't go from downstairs to upstairs. So it's important that the patient is the one driving this and setting that goal. And we're meeting the needs of the patient and not necessarily a clinician dictating what needs to be done. So definitely the caregiver and the patient is involved.
Oh, very good. So how does the Mississauga Halton CCAC care coordinator approach and help patients and families? Can you show us or share with us some examples?
Yes. I will share the example of a lovely couple that I met, Betty and Patty. Betty, the patient, and Patty, her husband. For this particular patient, unfortunately, she suffered for over 6 months with a pain issue that she was going through. And when I visited her, it was basically entering into her world, having her explain to me what's going on. what her needs are, what does she want. And basically what Patty said is, I want to get rid of this pain. I want to be able to function as I normally do. I want to go back to the community center at the Cawthra Community Center and be involved as I was before. You know, I want to be able to access the upper level of my home. This was one of her goals. I want to be able to function as I normally do. And in that scenario, I enter into that particular case and I look at what is needed here. We set up certain services such as a physiotherapist to help in terms of improving mobility, nurse in terms of pain management, and of course the doctor is always involved. So it's getting a host of people involved, a personal support worker to help her at the moment because she was having difficulty with her personal care, and working together with that team in collaboration to help to meet the needs of Betty in terms of decreasing her pain and increasing her mobility and overall function. And that is what we achieved at the end of the day. So it is going into the person's home, actively listening, being empathetic. As a Christian, it's something that also it aligns with my values, really. Going in and being compassionate, thinking, if I were in that position, what would I want to happen? What would I want someone to do for me? And that's exactly what I did with Betty and Patty. I listened to them, and I gave them exactly what was needed. For Betty, I put the necessary services in place, speak with all the players, ensure that we were all on the same page. We all knew what Betty's goals were, and we were all working towards that goal. In terms of Patty, he loves his wife so much, and so he was working overtime ensuring that her care needs were met. And he was getting burnt out. So it was putting in service in place, ensuring that our PSWs would go in and do that personal care and give Patty a break. So at the end of the day, it is meeting the needs of both the patient and the caregiver. And that, in a nutshell, is the role of the community care coordinator, going in, enter into a person's situation, and seeing what can be done to help to meet their medical needs and their social needs.
And what tools are in place to really measure the success of some of the programs that are implemented? Does CCAC have a tool that measures these successes?
Yes, as a care coordinator, we're highly involved. It's not just a one-time visit to the patient's home. We have care conferencing that is often done either via the telephone, so it could be a teleconference, or it could be a video conference, or it could be conference in person. At times I actually go to a doctor's office, sit with the doctor, the patient, and at times the various providers in place, and we work on the set goals, and we see where we are at from time to time in terms of meeting that goal. Are we achieving what we set out to do? And I'm in constant contact with the patient. I do follow-up calls. They are aware that they can call me at any time. And before a patient is discharged, because the goal is to get the patient to a point of independence, so before they're discharged, we ensure that the goals are achieved and they're actually at the place where they say they want to be.
Natoya, we'll continue this conversation. We'll be back after a short break. Stay with us. Welcome back to About Seniors Talk TV. We're speaking with Natoya Hylton from CCAC. Natoya, can you share with us some feedback that you've gotten from families with regards to some of the services that CCAC provides?
Yes. We provide really exceptional care for our patients, and I find that there are a lot of extraordinary people in our organization working towards patients achieving their goals. And at the end of the day, I have patients say to me, thank you so much. Without CCAC, we don't know how we would manage. We would not be able to remain in our own home. We'd have to look at going into some kind of alternate living arrangement like a retirement home or a nursing home, but thank you, I can stay in my home, and there's absolutely no place like home. So there's just so much that patients over the years have said, and so much that they've done. Sometimes they send thank you letters to say, thank you so much for what you've done in coordinating the care. Thank you so much for the individuals who actually provide the care from the various service provider organizations. Thank you because now I am able to walk, and I wasn't able to walk before. You've given me hope. You know, you've helped my husband, you helped my wife, you've actually prevented that caregiver burnout, and there's not enough that some patients can say just to express their appreciation and gratitude for what we do at CCAC. So yes, a number of patients have expressed thanks.
Can you describe what sort of care plans CCAC puts in place once they're approved for some hours for home care? What does that care plan looks like?
A care plan is put together based on a patient's needs. So it is based on what the person says is needed in a particular situation. Let's say, for example, there's a patient who is having frequent falls at home, they're not safe at home, and they want to be able to function safely in their own home. So it would be a matter of possibly getting an occupational therapist in place and working on getting the necessary safety equipment if needed. It might be that they need a mobility device like a walker or a cane. They might need bathroom equipment for them to safely shower. So basically it is putting in those services and connecting them with care in the community, either directly through CCAC or through other healthcare organizations. So it could be a matter of referring them to Lifeline, for example, because if they're having falls and they live alone, they might need something like a Lifeline or a call alert button that they could press in the case of an emergency if they've fallen. It could be for a patient, let's say, who have decreased mobility and they want to increase that mobility. So a physiotherapist would be put in place to actually help to achieve that goal of increased mobility or enhanced functioning.
And CCAC coordinates all of these activities for the clients or the family?
Yes. We are the ones who would assess to see what the needs are, put the necessary services in place, and have these healthcare professionals report back to the care coordinator, to CCAC essentially, to see whether or not they're actually on the path to achieving the set goal. So the goals are driven by the patient themselves in letting us know what the need is. We then put the necessary supports or services in place, give them the necessary tools and resources, and help them along the way and monitor as they progress in meeting those goals.
Okay. So does the family or the client need to qualify to access some of these programs through CCAC?
In order to access the service through CCAC, one has to have a valid health card, and you need to have some medical need or some social need or some clinical need that can be met in the community, either in your home or in a clinic. So, for example, a patient who has a wound, ulcer, for example, and they're not able to take care of that on their own. It may be that we put a nurse to visit them in their home if the situation is such that they're not able to go outside of their home to access that. So the nurse would come in to do that wound care. Or it might be that they need IV antibiotics. The nurse would come to the home to provide that if they're not able to go to a local clinic close to their home. So it depends on what the need of the patient is, and the services are put in place based on the needs to help to meet those needs.
Okay. So CCAC works with different partners in the field in order to facilitate and deliver care to the client's home. So do they have assistance, let's say if they're incontinent or they require bathing or help with their meals? Does that CCAC do that through either through CCAC or their health partners?
Yes. CCAC, we either provide care directly through contracted agencies, or we connect patients to care from some other support agencies out there in the community. So for example, Victor, the patient that you mentioned who requires assistance with personal care, we would put a personal support agency in place, most likely through one of our contracted agencies. So it would either be a VON or a Spectrum or SRT or any of those agencies that have contracts with us, and the personal support worker would go out and provide that care, helping that patient with a shower, helping that patient getting dressed, or with that incontinent care, whatever that is needed, helping them to the washroom, changing their incontinent pads if that is what is needed. So yes, we provide service through contracted agencies, through our partners in the community,
in order to meet their needs.
In order to meet the patient's
So if
needs.
somebody meets the criteria for care through the criteria that CCAC has, what are some of the applicable fees that a client or family would have to pay under those circumstances?
This is the best part. With CCAC, we're funded by the Ministry of Health and Long-Term Care, so there is absolutely no cost to the patients for the services that we provide. So we provide a range of healthcare services such as occupational therapy, physiotherapy, social work, personal support, dietitian, you name it, and all these services are no cost to the patient because we're funded through the Ministry of Health and Long-Term Care.
That's great. It is the best news.
Yes.
So how do you connect with clients, family doctors, and other service providers to really be a full spectrum support to the family and the client?
We provide collaborative care. We try to ensure that we get everyone involved when we have a care plan. We get the doctor involved, we get the various service provider organizations involved, and that is normally done through conferencing. So it's either direct face-to-face or probably over the phone or video conference. So normally we have a coordinated care plan that is created by the care coordinator and the patient, and every member of the care team receives a copy of this care plan. So a copy is sent to the family doctor, a copy goes to, if it's a therapist that's in, the therapist gets that copy. If it's a personal support agency, they get a copy. The nursing agency, they get a copy. So we're all working from the same care plan with the singular goal of meeting the patient's needs, and we at times do that face-to-face conferencing where everyone can put it out on the table as to what they're doing to meet that singular goal that the patient has put forward as what's most important to them.
With the client being the center.
The client, the patient being the center.
The patient being
Yes.
the center. Natoya, thank you so much. I appreciate you coming on the show and sharing your extensive knowledge and experience working through CCAC and sharing with our viewers.
Thank you so much for having me again, Victor. Appreciate it.
And that wraps up the first episode of About Seniors Talk TV. I would like to thank my guest on today's show, Natoya Hylton. For more information about the topics discussed on today's show, you can reach me directly at volivera@inarcareservices.com. Thanks for watching.